You have come from a legacy of strong people. We are strong, we are smart, we are overcomers. Not only are you supposed to be at the table, but because of the adversity we have faced, we have the ability to lead even in adversity. We are uniquely qualified to be in places where there are challenges and difficulty and there's no way forward, there's no paved way forward, and they need someone to figure a way out. We're the ones to figure it out.
Hello, listeners. Welcome to the You Belong in Here podcast. This is a podcast where we explore the intersection of nursing and racism, racial disparities that African Americans face in healthcare, as well as the inequities that African American nurses, doctors, and nurse practitioners face in the workplace. My name is Dr. Tiffany C. Brown, and I am your host. I am a doctoral level nurse practitioner with more than 23 years of practice in the nursing profession. It is my hope that through hearing the personal stories of triumph and resiliency shared through in-depth interviews from nurses, nurse practitioners, doctors, and DEI experts, you will be empowered in your workplace and know that you belong in here. Now, let's get to our show. Welcome back to another episode of You Belong in Here podcast. My name is Dr. Tiffany C. Brown, and I am your host. I am excited to introduce you to my guest for today's episode entitled Need for Representation, Impact of Black Providers in the Community. I am speaking with Dr. Rhonda Hamilton. With over 23 years of experience in the medical field, Dr. Hamilton is currently making a significant impact as a chief of primary care at a clinic in California. Not only does she care for her patients, but she also dedicates her time to shaping the next generation of doctors by teaching medical students and residents. Dr. Hamilton earned her medical degree from Tufts University and completed her residency at Cambridge City Hospital, a very prestigious Harvard teaching hospital. Her commitment to her profession is matched by her compassion as a wife and a mother. What truly sets Dr. Hamilton apart is her passion for addressing healthcare disparities. She eloquently stated, "As a Black female physician leader in medicine, I wanted to think about how I leverage my position to address disparities in care for Black and Latinx patients." Please join me in welcoming Dr. Rhonda Hamilton. Hi, Dr. Hamilton. Thank you so much for joining me today.
Thank you for having me, Dr. Brown. It is a pleasure to be here. And let me just say, the work that you're doing is outstanding and really needed. I'm so happy to be here. Thanks. I'm honored. Thank you for asking me.
Oh my God. Thank you so much. I really appreciate you for saying that. So because I know I respect your time and because we have a lot to discuss, I would like to just jump right into it.
Sure.
For those who have been following my podcast, you may know I like to start off with some statistics. So I shall this time too. In 2018, the American Association of Medical Colleges reported that only 5% of all active physicians were Black, whereas Black people make up about 13% of the U.S. population. So, Dr. Hamilton, what does representation mean to you in the context of healthcare, and why is it particularly important for Black providers in the community?
Well, that's a great question. And it's a bit frustrating, isn't it, that there's only 5% of us in the medical field, with 13% of us representing the population.
Yeah.
But let me just say a quick word that it's pretty amazing that about those 5%, because we have come through so much as a people. To be able to go through what you have to go through in order to become a doctor, nurse practitioner, or a physician like myself, it's a lot, even if you're not Black. But if you add the Black on top of it, I have to kudos for those 5%, right? And I would say that it's so important that we increase those numbers, because when I'm sitting there in my clinic with a Black patient, there is just that one barrier is removed. And what we want is to remove barriers.
Absolutely.
And that barrier of culture, that barrier of someone looking like me and understanding who I am, that barrier is removed. I will say it's not 100% removed, It's not 100% removed, but because I know that there's still a lot of, is she one of us or is she one of them? And it can still be a little bit tricky. But I would say that by and large, just because of who I am, many of my Black patients feel very grateful to have someone who can just connect with them on a cultural level. I mean, you take it, someone who has diabetes.
Yeah.
Well, we're talking more about sweet potato pie than pumpkin pie, right? We understand. We're talking more collard greens than kale. So it's easy for me to be able to throw out some things. Hey, take your collard greens, and instead of putting neck bones in it, put smoked turkey. You see? So I can come up with those because I'm in my own kitchen making the same thing. So it makes a big difference to have someone who looks like you, who's grown up in places that you've grown up in, who has a journey that in some way mirrors your journey, to make it so that the bridge for how to make collard greens to taking your medication is not too far of a jump.
Absolutely. Absolutely. I couldn't agree with you more, 100%. Given that I work in the cancer center, at a hospital here in California, it is when I walk in the door and I see the patient looks like me there, it's almost like family. Then
That's right.
That sense of, because we each share a similar culture, they feel more relatable to me.
That's right.
But yeah, it's amazing. Dr. Hamilton, can you share a bit about your journey into the healthcare profession and actually what motivated you to become a provider and then be a provider in the community?
Well, Dr. Brown, you probably don't know much about my beginning story of how I came into medicine. And it would take about 2 or 3 hours to really go through the details. But I'll tell you this. The main thing that I will say is that my journey into medicine was nothing short of supernatural.
Yeah.
I really felt a particular call from God to come into this field. I was happily teaching English at a university. I was set. My career path was set when I had an encounter with the Lord that convinced me was so powerful and so unusual and so undeniable that I decided that I was going to heed the call. Because when I accepted Christ as my Savior years ago when I was a teenager, I said to God, if you show me what you want me to do, I will do it. No matter what it is, no matter how outlandish, because there's no one in my family who's a doctor. This is brand new to our family. But I told God, I made that deal with him. If you ask me to do it and I know it's you asking, I'll do it. And he made it very clear that this was what he was asking. So I actually left my position as faculty on a university campus teaching to go to school with my students because I had to start all over. I was an English undergrad and I was teaching English at the university. And I went back and did my medical prerequisites without having any background in science and math. So it just goes to show you take this English brain and you use it and leverage it to God's glory and miracles can happen. And that's what happened. My whole journey was a miracle from beginning to end because I struggled in math and yet I was able to conquer and master physics, conquer and master calculus, chemistry, algebra. When I was in high school, I thought I would never even pass algebra, let alone make an A in algebra. But this is what happens when you're called by God to do something. He opens the door of your brain so that you are able to step right into your purpose. And that's the reason why. You see, I have this assurance of knowing that I'm right in the middle of God's will. And because of that, when I face all sorts of trials and tribulations on the job, and there are many, maybe we'll get into some of them, I don't have to ever say, did I make the right choice? Am I supposed to be here? Am I good enough? Am I smart enough? That never comes into my mind because God doesn't make mistakes. And so I know that I am called to do this work. And if it looks like it's too hard, nope, it's not too hard. I just need to give myself more time. I need to read some more. I need to interact some more. I need to not be afraid to raise my hand and ask a question. And then when you ask that question, 3 other people are writing the answer down because they had the same question. So it's really about walking into your self-confidence. And then for me, I call it a God confidence because I have confidence that God knows what he's doing. And so that's how I came in. I heeded the call, supernatural call from God, and it has made all the difference for me.
Amazing. I feel like I should say amen at this point because I'm sure there are plenty listeners who may be trying to hear that call,
Yes.
trying to ascertain what that call looks like in whatever profession they're getting ready to go into.
That's
so I
right.
really appreciate you for, even bringing God into this conversation as a part of your journey, because I could definitely say it was a part of mine as well. And you may or may not know some of my testimony, but yes, this is definitely a God call, and God makes no mistakes.
Amen.
God makes no mistakes, and God will be with you on your journey and in your path. If you're listening, God will be with you in your journey and in your path.
Yes.
Thanks for sharing that. So, Dr. Hamilton, how, would you say, or do you believe that Black providers can serve as a role model, even in what you said right now, for the younger generations in the community, considering their careers in healthcare?
Well, I think I will share very transparently a mistake I made early on in my career. I think I kind of scared some people away from the field because as you can imagine, I would get lots of younger Black men and women, students saying, "Oh, I want to be a doctor. What is it? What do you have to do to become a doctor?" And I think that many times their expectation of what it takes and requires to become a physician, or in your case, a doctor of nurse practitioner, you can speak to that yourself.
Yeah.
It's different than what it actually is. And a lot of them thought that they could go through medical school and kind of breeze their way through it, not have to study that hard, not put in the work, just be really nice to the teacher and it would all work out. And I really explained to them my self-discipline that I had to implement in order to pass these tests. These tests are not easy. And good looks and a nice smile does not pass. So you have to put in the work. And I talked about the regimen that I put on myself, that I have this whole study regimen that is really quite intense, where when I first start studying, I'll take a 4-hour block and I study new material for 40 minutes. And then I take a 15-minute break. And then I come back and test myself in those 40 minutes worth of material by asking myself questions. So at the end of that 40 minutes, I write a question about each thing that I learned. I take my 15-minute break to give my brain time to relax. I come back and I look at those questions and see, can I regurgitate them? And I repeat that and repeat that and repeat that. And then at the end of the week, all I do is look at all of my questions and go back and answer those questions. Well, by the time you do that for weeks and weeks and months, it's taking hours of your time. And I think when they heard that, they thought, oh, this is more than I really signed up for, And so now what I try to do, because I don't want to scare people away, but I also want to make sure they know that this is no small matter. And nor should it be. Mm-hmm. Because if you are the one in charge of someone's health, they're coming to you, like with you, oncology, cancer, the big C word. You don't want someone who was on TikTok instead of in the books. So you need someone who's serious. You need someone who's put in the hours. And so I think I have to balance my approach so that I don't scare people away, but I also hold their feet to the fire.
Right.
And I think that is the most important thing, is letting them know you belong here. Now, let's see. Now that you know that you belong here, what do you have to do to keep your place?
Absolutely.
And that is the balance that we as clinicians have to be able to do. So now I have people come to my clinic, they get to shadow me, I give them homework, they come back, they present so that they can see what it's like.
Absolutely. It's kind of what you're saying is kind of flashing with me to go right into what I was going to ask you, which, in the church, we have been known to say, what, greater levels come with what? Greater devil.
Greater, that's right.
Right. So ultimately what that means is increase does not come without some form of opposition or obstacles. Now, you talked about the studying may have been an obstacle for you. The classes, algebra, like those things that are challenging. But what other challenges would you say you have experienced, even just as a Black provider? And what barriers do you believe exist for others that are looking to enter this profession outside of the schooling, like in getting A's? Because we know they don't give out A's for free. You have to earn every single A. Okay.
Well, you are absolutely right. And I will say, outside of the academic piece of becoming who we are as clinicians, I would say that I've had, I don't want to call it unusual, but I will say a unique place where in every position I've had in the field of medicine, I have been asked to be someone's supervisor. I've been asked to be promoted in every situation. And so what is that? What is it about me that I am chosen to be a leader? I'm chosen to be the boss. I am asked to be the boss. And I would say, and in each of those contexts, I'm always the only Black person. So they're choosing me to be their boss, even though there's no one else who looks like me. Now, I would say, when you say, what is that? Is Rhonda Hamilton just that great of a leader? Nope. I'm actually not that great of a leader. I'm learning how to be a good leader. I want to be a good leader, but I have a lot to learn. Is it because I'm so smart? Nope. I always say I'm not the smartest person in the room, but I will work hard. I'm what you call a grinder. I work hard, but I may have to read a passage 3 times, and Dr. Brown, you may only have to read it once. So it's not that I am so smart or such a great leader. I would say it's this. I know I belong in this place. So I definitely have the God confidence. So, and I'm also not a shrinking violet. Okay. So I have the God confidence. And I also, because I have the God confidence and I'm confident in who I am, I have no problem identifying the greatness in other people.
Awesome.
And because I verbalize the greatness that I see in other people, it takes away any threat. It takes away any competition, because I'm able to say, hey, guys, I'm not good on Excel. Hey, you, Joe, you're really smart in Excel. Can you show me how to do this calculation so that we can put this data together? And then when I'm giving my presentation, hey, everybody, Joe is the one who gets credit for this because he put the presentation together. I have no problem giving credit to everyone else. It's no problem to me. It doesn't diminish me. In fact, it builds me up because I have all this great team who works around me. So what I would say is, and I'm still learning, is many times you'll see greatness in other people, but you won't call it out. You won't say it. I call it out. I'll stop a meeting mid-flow and say, I just want to call out so-and-so who identified this need and came up with the way forward. I have been struggling for 6 months on this. Okay, you guys can continue on. That disarmed everyone in the meeting. And so what I would say is that although you ask about barriers, I want to talk about how I was able to break down barriers.
I love it.
I'm able to break down barriers using my words. So it just goes to show God makes no mistakes.
Absolutely.
I came into this from a background in English where language was my tool. And now I use that tool, which I thought was wasted time. Who cares about Shakespeare and Toni Morrison when you're in there taking care of medical issues? But everyone needs to hear words. Yeah. Everyone needs to hear affirmation. And so it is the language and the relationships that have broken the barriers for me and have allowed me to rise to levels of leadership. So I just want to comment on that.
That's also, I mean, I think what you're saying is signs of a great leader. Like not only do you elevate other people, even in your position, like you acknowledge people. You're only as good a leader as the people that you have that are helping you. You understand that it doesn't all just come from you. You know how to utilize your resources and be a resource. So I think all of those are good signs of a leader.
Thank you. Thank you.
Absolutely. And so can you also discuss maybe any stereotypes or misconceptions that you've encountered in your role? And how has it affected you, like working with your patients or interacting with your patients?
I would say that when people see me, okay, first, let me just say this. Most of the patients I care for right now are white men. That's the largest population of people that I take care of right now. Now, when they walk in and they see me as being their assigned primary care doctor, I am sure that they already have a preconceived notion of who I am and what I bring to bear. And I might notice that with some of their first comments. So what school did you go to? Right? What school did you go to? They want to make sure, is it a reputable college? What school? Oh, and how long have you? And many of them tell me, I Googled you. I know your whole resume. No problem. And so what I have found is that I lean in to who I am as a Black woman. 100%. There's two ways you can go about it. You can try to show them how you're like them, or you can lean into who you are as a Black person. I lean right into where I am as a Black person. I talk to them in a professional manner, but I talk about my culture in a beautiful way and all that it brings. We are such a smart and creative people. And what a blessing it is for this person to have me as a doctor, because I'm bringing all of my culture and my intellect and bringing it to bear for them. And so what I would say to you is this. When I used to run the intensive care unit, this is what I noticed. And this is what I love about being a doctor. You get immediate intimacy with people because they're sick or dying and afraid. And I come in with the answer, a remedy, and a solution. And what I have found is they don't care as much. They could be completely racist, but they don't care about their racism as much as they care about their health. And they're more afraid of that condition than they are of me. And so when I come to them and bring the evidence, and so that's why you have to know your stuff. That's the reason why when I come into the room, I'm the expert in the room with confidence. There's no shadows or camera tricks. I really do know what I'm doing. And I can demonstrate that, and I can articulate that, and I can help them feel better about their condition. Because the beauty is God has made such healthy, strong bodies that with just the right treatment, we can get right back in shape. Health can be ours if we do the right things. And I come with the tools and encouragement. And boy, oh boy, I would say that my white male patients love having me as their physician. And I will fight for their health like I fight for anyone else's health, because they are my patient. They are my charge. God has called me to take care of them. And so it is my honor to take care of all of my patients, my homeless patients, my wealthy patients. Anyone who comes in front of me, I'm going to take care of them as if they are my own family.
I love it. Wow. It's so empowering, to say that you welcome, being yourself, and welcome you coming with a cultural confidence and knowing, like not only you may ask me where I went to school. I'm proud of where I went to school. Yes, it is reputable, but I'm coming with evidence-based practice and care for you,
That's right.
So great. You looked me up. Oh, wonderful. I love your confidence in this. And this is going to help somebody. If you're listening out there, go in with your own empowered cultural confidence. Don't let anyone ask you, make you feel intimidated,
Right.
because you are African American or because you're a Black professional, because you may be the only one in there. I love it. I kind of want to ask you another question, though. I know you said you mostly work with white patients or white population of patients, but I know that multiple studies have shown that greater representation of Black PCPs, primary care physicians in the workforce is associated with an improved survival related outcomes for Black individuals.
Absolutely.
Have you seen the presence of Black providers affect healthcare outcomes and healthcare access, even in the communities that you have worked in over the past 23 years?
Yes, yes, yes. That's an excellent quote. I'm glad you found that. I'm glad that you said that. It is huge. Although most of my patients are white men, I have a huge representation of Black patients. And I would say my demographic panel has to do with where I live. Okay. Yeah. And so it's where I live. So I have a representation based on where I live. So what I would say is it makes such a huge impact in their outcomes. I mean, one thing that I would say, and I'm doing a health fair at my church coming up this summer. This is the truth. And anyone who's out there practicing medicine will be able to align with this, and they'll be able to resonate with what I'm saying. When you have a patient who comes into your clinic unprepared for the visit, you can only get so much done. And one thing that I will say is, and this is not just Black patients, this is patients who live lives of any kind of socioeconomic disadvantage. Because when you come into your appointment, how much time you've put into the appointment before the appointment has to do with are other parts of your life in order. So if you're sitting on a bunch of money, you have plenty of time to prepare, search the internet, write everything down. Oh, this medication has this side effect. Let me ask about that. When you are like some of my Black patients and some of my white patients and some of my Latin patients, it's not just based on color, but usually it's based on money. And it just so happens that so many more Black people are poor. So it's not really having to do with them being Black or Latin, but just poor, is they're working 2 jobs. They go to the internet and try to look something up. They may not have had the same education or time to research it. Yeah. Because a lot of times we don't know, my white patients don't know what this is either. What's hypertension? Oh, that's high blood pressure. You have to do the research, the time, and the anxiety. Oh my gosh. You see the worst case scenario on the internet and it makes you afraid. And so you stop looking at it. So anxiety, trauma, PTSD, all these things are barriers for patients to get good care. So when they come in and they see me, and I can allay some of their fears and say, hey, don't you worry about it. This is what we're going to do for this visit. For this visit, all we're going to do is write down all of your concerns. And the next visit, when you come back, we're going to go through each one by one. Let me help you process. Let me give you a homework assignment of what you need to do before you come back. And so me understanding, because we all have family members who do not do what they're supposed to do, right? I have had to do this with my family. So I'm doing the same thing with my patients. Yeah. And so me resonating, oh, he's just like my uncle so-and-so. Yep. Yeah. So, no matter how high his blood pressure is, he wants more salt. So I say, let me talk to you about some salt alternatives and some different ways to eat. And I can come, like I say, from a place of cultural competence and alignment. So I think all of these things come to bear, me being a Black female, me being raised. Part of my life, I was raised in the inner city. Me coming from a place of having my own traumas, I can relate. I can relate 100% because it's not me on this side of the table and them on the other side. I'm right here next to you. We're both fighting this disease. You know what it is? It's me, the patient, and the disease is over there. We're both fighting the disease. Yeah. So I'm aligning in a different way with my patient. They're not across the desk. We're partnering right next to each other. And the disease is the enemy, and we're allies. And that's what I talk about when I talk about how to get the best care for my patients. I talk about partnering with them and the enemy being the disease.
Absolutely. I love it.
That's how you do it.
I love it. Earlier, you mentioned that you were going to be doing a health fair with your church. So
Yes.
I want to ask you, like, what strategies you believe are effective for Black providers to collaborate with local organizations, community leaders, and policymakers to improve community health? Because I'm looking at the health fair that you were having at your church. That's community. So
That's right.
what would you say about to that?
I think any of the nonprofit organizations, churches, YMCA, YWCA, Red Cross, all the places where people gather, that's the place where we can go
Yeah.
and really impact care. Because one of the tables we're going to have set up is how to prepare for your appointment. That is everything, because there's so much to know. How do you prepare to your appointment? If you come to the appointment and you don't have anything in your hand, you're not prepared. What are the things you need to do? So I think partnering with nonprofit organizations and everyone coming together and bringing the resources that they have and the knowledge and the expertise, and then bringing it all together, hopefully for free for the patients and for the community. Huge. You learn so much at those community fairs. So anyone who's listening, please do the hard work of being in the trenches and donating some of your time to health fairs to help the community. It's so important. I have picked up diabetes, hypertension, everything just at health fairs.
Yeah.
Just at health fairs. People have been walking around with sugars in the 300s and didn't know about it, but we checked their sugar and we found it.
Yep. So because respectful for your time, we're going to transition into the words of wisdom segment. This is my last question for you. What advice would you give to aspiring Black healthcare providers looking to make it not only just impact in their communities, but an impact in their hospital organizations?
Not just in their communities, but in their hospital organizations. My words of wisdom would be this. Number one, you have come from a legacy of strong people. We are strong. We are smart. We are overcomers. That's number one. Not only are you supposed to be at the table, we have the ability to not only be at the table, but because of the adversity we have faced, we have the ability to lead even in adversity. We are uniquely qualified to be in places where there are challenges and difficulty and there's no way forward, there's no paved way forward, and they need someone to figure a way out. We're the ones to figure it out because we come from people who have had to figure it out and who have overcome. That's who we are.
I love it. I want to end with that because so beautifully stated. You are preaching, Dr. Well, folks, this concludes this episode of You Belong in Here. Thank you, Dr. Hamilton, for being such an amazing guest. I could talk to you for much longer. We may have to do a part 2 because I hate our little 30 minutes is up. But thank you for being an amazing guest and sharing your journey into medicine and all the pearls of wisdom with our listeners today. Thank you, listeners, for tuning in once again. We hope, as always, that this episode reminds you that your presence is necessary and that your voice matters in healthcare when it comes to being a Black healthcare professional, as well as when it comes to being a patient. Your presence, our voice are necessary, and you truly belong in your workplace, as well as in your place of education in school. As usual, if you found this episode encouraging, motivating, inspiring, and or empowering, because this was an empowering episode, in any way, please like it, share it with others. You can find my podcast on YouTube, Spotify, Apple Podcasts, as well as my website, belonginherepod.com, where you can find more information about my guests. So tune in to our next episode in 2 weeks, where we will continue to explore topics in equity in healthcare and equity in the workplace. Until next time, take care and keep pushing forward.